delighted to introduce our next speaker. This is Matt Hazledine, who's founder of Lymphoedema United. It's actually an organisation, a charity that I wasn't completely aware of, and when I've looked into it, you do some incredible work. And Matt is going to talk to us about how to live better with lymphedema. So over to you, Matt. Thank you so much.
Well, thank you very much indeed for the opportunity. I really appreciate it. It's nice to get the patient voice represented within the field of healthcare professionals. Thank you very much indeed for allowing me to present how to live better with lymphedema. I'll tell you a little bit about my story and some of the important takeaways, I think, from almost 14 years worth of learnings as somebody living with lymphedema. So without further ado, just a brief touch on my story. Diagnosed the day before Father's Day on June 2011, so nearly celebrating my lymphoversary. And the lymphedema was diagnosed as a result of a perfect storm. I'd had surgery a few years prior when they thought I had a strangulated hernia, and when they operated, they decided to take some lymph nodes out to send off a biopsy, which caused weakness number one. I then fell down some stairs carrying an oak table and had some pretty tremendous bruising down my legs and backside. And then about 2 months later, got cellulitis infection, which put me in hospital for 2 weeks. And the colour, as you can see, letterbox red, very, very painful. It spread from a 5p piece right up my leg to the thigh. And the consequence of that was lymphedema. And on measuring, as you can see there, it was just under 60% bigger than my right leg. And there it is. There's the leg. And pretty life-changing stuff. That was in my 40th year, with lots of new exciting things going on, with a new business, a young family, 2 daughters. And then this episode hit, and I can tell you at the time it was fairly life-changing. So poll question number one, and I think Dawn and Sarah are on hand to help me with this.
Yeah.
Just there's over 200 people in the audience, and obviously I can't see you, but just to give me an idea of who I'm talking to, do you have lymphedema? Yes or no? You can answer the poll.
We're just waiting, Matt, for the majority to answer, and then I'll show the results for you.
That's great. Thank you very much.
I'll end it and share the results.
Okay, so nobody has lymphedema then. That's interesting. Okay, well, I hope in that case, this presentation is beneficial. And let's go back to the presentation. Where's the presentation gone? It was there a moment ago.
We can still see it.
Okay. From my screen, it's gone, which isn't helpful. Okay.
I can just see
there we
the
go.
poll
Right.
questions still.
Here we go.
So
Back
there
on
we go.
track. Back on track. I just had to exit out.
Perfect now, Matt. Thank you.
So none of the audience have lymphedema. Okay. So hopefully this will be of interest from a patient's perspective of what it's like to live with the condition. I think the first challenge, having been in hospital with quite a scary episode of cellulitis, which was just caught before serious sepsis has set in. They were throwing absolutely everything at it. I went in over the weekend, so the cultures didn't come back until the Tuesday. They were talking about an X-ray and amputation. It was all very scary in a short period of time while dosed up on drugs. On discharge, 2 weeks later, the information was scarce. I was told by the vascular surgeon, "You've got lymphedema. It's incurable. and go and collect some stockings from suppliers before you leave. So it's pretty hard hitting, not very soft in its delivery. So I turned to my GP, and sadly, bearing in mind that was nearly 14 years ago, the GP had a lack of knowledge about lymphedema, and more importantly, where to point me in the direction of help. So it left us wandering the country, my wife in particular, search engines and trying to find help, to find a local therapist. Again, it was quite a scary period. This thing came out of nowhere and was life-changing. And I often refer to it as wading through treacle in thick fog. Very desperate, emotional time for all concerned. So I'll touch on my battles. Acceptance, I think, is the main one. And for some I've spoken to through Lymphoedema United, this can take months, in some cases years, in some cases not at all, where they're still angry after, 2 decades of diagnosis that it's happened to them, in particular when they've survived cancer and they then get lymphedema, which is a daily reminder of the journey that they've been through. Clothes and shoes. There's one not to be ignored, because clothes maketh the man, maketh the person. And I suppose it was 2 weeks after leaving hospital, I realized that every pair of shoes, every pair of trousers, jeans, suits that I had in the wardrobe had to go to charity. Nothing would fit. And I was running a financial services firm at the time, and I had to wear essentially clown's jeans and trainers to the office below the desk with the shirt and tie above. So it was preempting what lockdown was all about. But this is an important area of daily life for anybody who lives with lower or upper limb lymphedema, because as you know, lymphedema poses physical challenges. Some you can hide away, and some are more obvious. Certainly upper limb, where it's less easy to hide away the hand glove or the mitten. And not forgetting the mental well-being. So in addition to being clumsy and bumping into things with my big leg, it did have an effect on my confidence, and it did bring me down for a period of time. The whole why me scenario, self-confidence was not self-esteem. And, I didn't know anybody else with lymphedema for many years. And I did feel alone, and a bit of a whinge bag, until I gave myself a talking to, and Peter Mortimer gave me a talking to in around 2015. So for years, probably 4 years, I buried my head in the sand. And this is not unusual. It's not unusual for many of the men I speak to as a result of Lymph United, who kind of just go about their business, but really struggle with talking openly about it. And luckily, we now have a male network who can do exactly that. So poll question 2, if I may, do you ask your patients about their mental well-being at every clinic appointment? Now, I do appreciate the time elements, the time restrictions of each appointment, but I'm interested to know whether that's incorporated within your 6 monthly clinic appointments or not.
Right, I'll share those results for you now, Matt.
Thank you. Oh, that's not bad. So 58 to 50. So 53 to 47. I'm pleased. And for those with the 47, I do understand some of that could be down to time restraints. And I know that should you ask somebody about their well-being and they start chatting, it can cause clinic appointments to overrun, and your day finishing at 10 o'clock at night. So I do understand that. But perhaps there are telltale signs that you can spot when it is the right time to ask them. So as I touched on, self-confidence, self-esteem, a big issue, not just for me and my lymphedema, but as a sector, I think, as a category. So sadly, it fell to my wife and I. And I'm going to give my wife some credit here because she's not here to hear it. But she was the one that did a lot of the research. She went all around the houses trying to find a local clinic. And I believe she spoke to Margaret Snedden. She said somebody up in Scotland. And Margaret, we believe, pointed us to a local clinic about 10 minutes drive from my house, where my GP didn't know where to point me. Margaret, we think, up in Scotland did. So once we found the clinic, it's about working together, as we all know, to reduce the volume, because having left hospital in a class 1 or 2 garment, it really didn't take effect. It was pointless. And my leg kept getting bigger and bigger, and I became clumsier and clumsier. But once I engaged with the local clinic in Pembury, a lovely lady called Kelly Nixon, who's very dear to my journey, then we were able to work together to reduce the volume. And that then led to her guiding and pointing us in the right direction to self-educate and to understand more about lymphedema, more about the condition, how to manage and cope with the self-management techniques, and why it was important to do so. That's quite a key point, why it's important to do so. It's one thing telling patients, this is what you need to do. But if you understand why and what could happen if you don't self-manage effectively, that could get more of a buy-in with those challenging patients who tend to disregard advice from the healthcare professionals. Self-acceptance, it does come with a little bit of help. And just to put that in perspective, I didn't wear shorts in public for 10 years. I hid away, even though after 5 years I was working as a trustee of the LSN. And then, of course, recently founding Lymphoedema United in 2021, I still hid away. But now I don't mind wearing shorts in public because it prompts the question and I can educate people. But it took a long time to get there. And self-care and self-compassion. And this is one of those ones where I need to remind myself to practice what I preach sometimes, because I've been at the desk for 4 or 5 hours today. I haven't got up and moved around much. I've been flat out organising meetups and emailing people who need help. But I have now decided, as of 2025, to have Fridays off. So Friday is my self-care day. I go and play golf, I go cycling, or just do something completely different and away from Lymphoedema United, which is quite healthy. But also self-management is so important. You know, during those 6 months when we're not seeing our clinician, it's up to us as patients to in inverted commas, to self-manage and maintain the limb and continue the good work that they've helped with, whether that's bandaging, whether that's wraps, whether that's made to measure compression. You know, I suppose it's joint motivational that if we do our job, it means that the healthcare professional can see the results, and therefore if we're compliant or concordant, they're more likely to perhaps go the extra mile for us in the future. So it's a message that I really do send out to the people with lymphedema that I talk to. But as we know, and sadly, this is still a problem in the UK and globally, but we're talking about the UK, is it's a postcode lottery. And I've spoken to people all over the country where they can have to travel hours. Some have to travel hours to a main clinic to get their 6-monthly hosiery. So this sadly is just the way it is. I don't need to tell you guys this, but it's certainly a challenge that the sector needs to address going forward as more people are diagnosed. But it is teamwork. It's the healthcare professional and it's us with lymphedema. But it's my lymphedema, it's my responsibility. But we all know the self-management techniques. I'm not going to dwell on them, but I just will drop in there that donning a 4S, which is what, 60 to 90 millimeters of mercury, is getting tougher as I'm getting older. So I do feel for anybody in the sort of mid 60s upwards who are trying to pull one of these these garments on. It's not easy. That links into the importance of properly fitted compression, because regardless of what you wear, if you don't wear it, it'll exacerbate the problem. But I need to just check with the audience what their understanding of wearing compression is. So quick question for you, regardless of whether you have lymphedema or not, and we know you haven't, have you worn a class 2, 3 or 4 compression garment for longer than 12 hours? Over to you, Dawn.
There we go, Matt. Share the results.
Thank you. Okay, so 22%. Yes, 78%. No, I'm writing this down. This is really interesting. Okay, here's a challenge for you 78% that haven't worn class 2. And class 2, if I'm honest, is one of the easier ones to don and doff. Try it, whether it's off the shelf or whether you speak to one of our lovely industry partners or industry suppliers to see if they can give you some samples of off the shelf. Give it a try. It might give you a little insight as to how fabulous these products are and how wonderful it is to wear compression on a daily basis. I wear a 4S during the day, and then I slip into a class 2 or a comfy wave at night. Yes, there's a little challenge for you. Let's move on. Properly fitted garments are important. This is the left side of my left foot near the little toe, where my slanted cut 4S was causing some significant pain with corns. And as you can see, I moved the garment down a bit and then up a bit. And eventually I was brave enough to say to my therapist, I need a different garment. This is really painful. But this was a number of years ago. I didn't have the self-confidence to raise my head and say help, because of the ultimate respect we have for our healthcare professionals. The other element, other than corns, essentially is rucking, where the garment may be a little bit too loose around the knee or around the ankle. And as you can see there, as the day's gone on, it rucks, it bunches up behind the knee, causing, as you can see, not a great picture, but folliculitis, a bit of abrasion of the skin, which, as we know, is dangerous because of cellulitis. And you can just see there the rucking, the welting of the skin, which could potentially, I'm told by my GP, lead to a DVT if I wasn't careful. That's a better shot of it. So it's quite uncomfortable, quite painful to wear. But again, it's about communicating these problems to the healthcare professionals and finding solutions. And I show you one of the solutions very shortly. So the challenges: if it's too tight, it's painful and damaging, you take it off. If it's too loose, it's ineffective, it sags down. What's the point in wearing it? Donning and doffing is an absolute struggle, especially a class 4S, especially in older age. Now, there are a number of devices out there, and I list many of them on my website under Meet the Suppliers. So if you're prescribing anything above class 2, perhaps if it's on prescription, suggest a couple of donning devices to help them with their struggles, because if they wear it, they're compliant and everyone's in a good place. Let's be honest. So up until recently, we've had black or we've had beige. It's a medical compression device. It's not fashionable until a number of the companies have produced patterns and colors, which actually for some people, they can incorporate it within their outfit. And I won't mention companies, but there are a few Instagram models, Nicole being one of them, who are very proud in showing off their garments. But if it's ugly, people tend to hide it away or don't wear it at all. All of those elements, just a few examples of how we can lead into non-compliance. And the danger of non-compliance: the swelling increases, mobility reduces, with a potential risk of obesity. As we know, obesity prevents some lymphedema patients getting treatment. BMI in particular can leave some people diagnosed with a long waiting list until that BMI is reduced, sadly. That's a lot of the feedback that I've received from people living with this condition. And if this continues, they become less mobile, they become obese, there is the potential of developing other health conditions. So it's important, therefore, that we sort this out. We work together to avoid non-compliance. And I think a lot of this comes from empowerment and education. And because of the respect that I have for healthcare professionals, for many years, I just did what I was told. I accepted what I was prescribed by my clinician. And it wasn't until the LSN that I realized that there were other products out there. And it opened my eyes. And what it did do was enable me to say to my clinician, look, I've seen this product with X company. Any chance I can give it a try? Now, rather than the rinse and repeat, it's good to try different products, because until you do, you don't know whether there's something better out there. But sometimes patients may not be confident enough to ask the question. But there are a variety of bespoke additions. You know all this, I know. Slanted cuts at both ends of the limb, silk pockets, but the game changer for my leg was the knee functional zone. Many of the companies provide it. My GP needs her arm twisting to sign it off. However, when she saw the pictures of my rucking and my welting behind the knee, she said, okay, this is potential DVT. You can have your knee functional zone. And of course, as we touched on, there's different colors and styles and materials to wear, all of which are listed on our website, but I'm sure your local suppliers representatives are in contact with you anyhow. But from a patient perspective, knowledge empowers us to work with you, the clinicians, the therapists, to find solutions. And the win-win for all of us is the perfect fit. Comfortable garments to wear and helping me to self-manage. And the knee functional zone and a fair bit of surgery, if I'm honest, has resulted in my leg looking more leg-shaped, and I don't get the folliculitis, I don't get the rucking, the soreness, the pain, which I hear a lot about behind the knee, and perhaps the elbow as well for others with upper limb, are a thing of the past. So if you haven't seen this, check it out. It's a game changer. And to give you some idea, they were the trousers I used to hide away in back in the day before lymph node transfer and 2 lots of SAPL or liposuction, fortunately through St George's at the NHS at the time. And so far that's that. So a little bit about where I've moved to, I suppose, since regaining some of my confidence and wanting to make a change within the sector and get the male voice heard. I worked with the LSN for 2.5 years with Anita and Karen as a trustee, and I then had to have my surgeries. So I stepped away, and then I decided to set up Lymphoedema United. And the first thing I did was write a book. At that time, it was approaching my 10-year lymphoversary. So I've written honestly and openly about my physical and mental challenges of lymphedema. And I'm blessed that over 20 lymphedema specialists, including 4 professors, you'll know the names, I'm sure, and many, many other really trusted names within the lymphedema sector wrote alongside me. So it's a bit like a lymphedema Bible. So there's a chapter, for example, on cellulitis. I write about my experiences of cellulitis and hand over to Professor Vaughan Keeley, Professor Christine Moffat, to talk factually, giving medical information and guidance, all in one book. So many people are in there. And 25% of the profits from this book are donated to the St George's Lymphedema Research Fund. The website, which accompanied the book, is a one-stop shop website for anybody with or working in the lymphedema sector. It's something I wish I'd have had when I was diagnosed. So I've put all of the solutions, meet the experts, meet the suppliers, meet the organizations and charities, meet the other members, and loads more, all on the site. And it highlights all of the products available and the solutions, including clothes and shoes, and each member, which is free to join, as you can see, gets a load of benefits, newsletters, bulletins, and a discount code. So if they want to go shopping, they get one code to redeem various discounts across all of the suppliers. So it's definitely worth a look. So the Meet the Members side gave me the idea of the book number 2, which is Lymphoedema United, You Are Not Alone. And through social media, through my membership, I connected with quite a few people around the world. And those of them that were willing to share their story publicly wrote in the book. So we have 34 people from 14 countries sharing their lymphedema story, all relatable, all really positive in the end. So they've gone through that typical roller coaster that we as lymphedema patients go through, and share their inspirational endings and provide top tips. And for this particular book, Amy and I donate a proportion of profits to global lymphedema charities, including the work I do with Christine Moffat from the ILF. So before we wrap up for Q&A, final question to you all. Would you recommend your patients to sign up as a member free of charge of Lymphoedema United? Yes or no?
There we go, Matt. Share the results.
I'll be seeing a 98% versus 2, so I've got to work on that 2%, but thank you so much to the 98. That's brilliant. For those 2% who need some further persuading, have a look around the website. The quarterly bulletins, the quarterly newsletters include stories and articles from other people with lymphedema, from healthcare professionals, from the scientists at Lymphedema Research Fund at St George's. Very, very interesting, and loads more benefits as well. So sign up yourselves. It's completely free, and I encourage you to sign up as well. So it's lymphoedemaunited.com, and all I ask for is first name, surname, email address, and for you to opt into the newsletters. That is it. So if you have your phones handy before we go into the Q&A, please feel free to take a photo of this page. It's got my email address. It's got my social media channel address. Although I've come off X, I'll be honest with you, it's not what it used to be. So forget X from that. And the website again is lymphoedemaunited.com, which is in the bottom left-hand side of the screen. So thank you very much indeed for your time. That takes us to 3:20. So I shall stop sharing the screen and hand back to Sarah to deal with the Q&A.
Thank you so much. That was absolutely brilliant. And like a lot of people have said, to hear a patient's story, someone who's experienced this, is really important. It puts it all into perspective. And I think it's a great way to finish a really informative day. So we've had the sort of science, the clinical application, but to finish it with your story is really important. I think, you know, you started off by saying that you had a service 10 minutes up the road or 10 miles up the road, I can't remember what you said, from your GP, and they didn't know about it. So, I mean, what was that again? Was that 10, 14 years ago, something like that? I'd like to think things have improved now, but there's still work to be done, isn't there, in educating our workforce in what sort of resources are around to support you.
Absolutely, and I think that's where us as a collective come in, because once you've got lymphedema and you've gone past the acceptance phase and you're ready to become an advocate, or even just spread the word a little bit, or be confident to share the fact you have lymphedema to others, it's about educating the GP. And Lymph United, Legs Matter, the LSN, the BLS, they have some fabulous material that can be left with the GP just to raise awareness and point them in the direction of the nearest clinics, which, you know, some sadly are cancer related only, Some don't deal with primary, as you know, I'm sure. So it's a real challenge out there for many people with lymphedema to find the right help.
There's a question here, Matt. Interesting, because obviously you talked about sort of your global work really in awareness, but the question is around, do you feel there is many differences around the world in lymphedema care? Have you picked up on any of that? Can we do better with what we're doing maybe in the UK? We can learn from other countries.
I think on the whole, we have so much to be grateful for in the UK. And I think that's largely to do with the NHS. That's largely to do with the professionalism and the compassion and the dedication of our NHS nurses and staff. You know, in some countries, they have to travel quite some distances, if not to pay for the treatment, or actually go to other countries. You know, I spoke to a lady in India who had to move house to Delhi. Her family moved house to Delhi so that they could be on the register to get treatment. Another lady from India moved to Canada. So, you know, there are differences, but there are similarities. So instead of a postcode lottery, it's almost like a state lottery or a country lottery in some cases. But lymphedema is lymphedema. Wherever in the world you've got it, it's the same. It's just a question of the level of treatment. And I'm pleased to be involved with various organizations and being invited to speak at more global events. So it's increasing my knowledge of what's going on in other countries.
I think you know it's right when you were saying around in the early days it's about not asking the questions you'd like to ask, or not maybe questioning the care that you're getting. And I know Legs Matter have done a lot around patient empowerment through education, because as a patient, any of us, we hope that that person in front of us, that healthcare professional, is giving us the right care. But if we don't know that we're maybe getting suboptimal care, we're not going to question it. And it's not until maybe you do your own research or whatever. So that is a problem, to have that confidence to ask those questions. Are there any hints and tips about how you could work with your healthcare professionals to improve that?
Yeah, I think there's definitely work to be done. Having said that, I think the majority, and me included, have utmost respect, and we don't take for granted the healthcare that we're getting. So to challenge that could result in a detrimental relationship to the patient. Having said that, looking at the banner of this particular campaign, say it, share it, change it, you're not going to change things for the better unless you're brave enough to share that information. So I think from empowering the patient, that there's more out there that they can see, that they can recommend with regards to garments, asking about massage, and maybe asking them to teach SLD at home. Not everybody's got the luxury of budget to spend on MLD or compression pumps. So I think one of the areas perhaps that could be volunteered more is, do you know anything about SLD? Can I show you how to do a couple of moves to sort of bridge that gap between now and your next 6-monthly appointment? So that's one element. So I think if I'm going to flip it, the confidence sits with the healthcare professional and the experience perhaps to ask these questions, in the same way that it's only recently that after 14 years of having lymphedema, that the subject of checking genital lymphedema has been broached. I've avoided it like the plague. It's a bit taboo. The nurses I work with at St George's, I know very well because of my work with lymphedema. It's kind of, you don't have eye contact, but I thought, no, this time I have to practice what I preach. And I broached the subject with Anchor, and we had a frank conversation and a very professional inspection, and all was fine. The bloke patient, I don't think is going to ever volunteer, will you check me? So again, it flips that back to the healthcare professional to perhaps be the lead on things like that. And just, you know, if they've seen them a few times, maybe that's the time you built the relationship just to broach that subject.
That's it, isn't it? It's the importance of that relationship, that trust, isn't it, as well?
Very
I'm
much.
really delighted that on your website you've got some, because someone asked the question about appliances to get to don and doff. because it is a minefield, isn't it? You know, hosiery selection in itself, but then what's the best aid to use? And it can be a bit of trial and error. So you say that you've got some information on that on the website.
Yes, on the meet the suppliers section, drill down to each of the suppliers. Most of them have a donning and doffing device. Some of the frames, some of the silk gloves that go over the hand or the foot, and then there's some really unique ones. For example, the Rowley & Cone from Sigvaris, which always gets a giggle when that one comes out, for obvious reasons. So it's just a question of browsing and seeing what works for the individual. Because one thing I've noticed, and I'm not unfit, but getting that 4S on at 54 years old is more of a struggle than it was 10 years ago, I can tell you.
Yeah, and we know that, you know, there are there's a large percentage of older people who, you know, they haven't got that dexterity, as you talked about, and that becomes a problem, isn't it? That is then the pressures on the clinical workforce or social care services to go in and don and doff hosiery. There's no easy answer, but I suppose, you know, it's good that we've got the resource there. And certainly I will be signposting people to your website now. It's you know, it sounds brilliant. So I want to thank you so much, Matt, for sharing your story. I think it's a really great way to finish such an informative day. I do urge you all to think about referring your patients to the website. As well as Legs Matter. I think, you know, the more resources like that we have, the better.